Surgically, ectopic pregnancies these days tend to be removed laparoscopically. And that's a minimally invasive surgical procedure where small incisions are made in the abdominal wall, and the use of a small camera attached to a laparoscope is then inserted in the abdominal and or pelvic cavity. There are two different types of laparoscopic procedures that are used to remove ectopic pregnancies. In this type of laparoscopic procedure, the pregnancy alone is removed, whilst the fallopian tube is left behind to heal on its own. The second type of laparoscopic procedure that is used to remove an ectopic pregnancy is a salpingectomy. With this type of surgical procedure, the entire fallopian tube containing the ectopic pregnancy itself is removed. And this is a procedure of choice if there is significant damage to the fallopian tube. If the tube ruptured and there was a lot of bleeding going on in the pelvic cavity, it wouldn't be possible to remove the ectopic pregnancy as well as the bleeding fallopian tube by just using a laparoscope. Under these circumstances, a laparotomy has to be carried out, and that is when a large incision is made through the pelvic cavity, and the pelvic cavity is then open in order to be able to remove not only the fallopian tube containing the ectopic pregnancy, but also to remove the bleeding that has happened in the pelvic cavity and in the abdominal cavity as well. Can you fall pregnant again after an ectopic pregnancy?